This image is divided into sections, focusing on medical terminology, pharmacology, and prescription writing. I will explain each section clearly and add details related to use, dosage, and potential risks. 1. Routes of drug administration, IV intravenous. Drugs are injected directly into a vein. Common uses, rapid administration in emergencies or when immediate drug action is needed, e.g. pain relief antibiotics. Risks, infection at injection site, vein damage, or overdose if administered too quickly. IM intramuscular, drugs are injected into muscle tissue. Common uses, vaccines, hormonal therapies like insulin, and pain relief. Risks, pain at injection site, infection, and risk of nerve damage if not done properly. Oral, drugs are swallowed in the form of tablets, capsules, or liquids. Common uses, most medications, including antibiotics, antihistamines, and painkillers. Risks, stomach irritation, interaction with food, delayed absorption in certain conditions. PR per rectal, drugs are administered rectally. Common uses, used when oral administration isn't possible, such as for children or unconscious patients, e.g. fever reducers, anti-nausea drugs. Risks, local irritation, inconsistent absorption. SL sublingual, drugs are placed under the tongue for rapid absorption. Common uses, nitroglycerin for angina, certain anxiety medications. Risks, irritation or allergic reaction in the mouth, potential for rapid overdose. 2. Prescription format, prescription Rx details. This part seems to be a typical layout for a prescription, which includes CC chief complaint, patient's main symptom or reason for the visit. OE on examination, findings after examining the patient. Adv advice, recommended treatments or lifestyle changes. Test, required tests or diagnostic procedures. Temp, recording body temperature. 3. Dosage forms, solid, liquid, semi-solid, gas. Solid, tablets, capsules, standard form for many medications. Risks, choking in some patients, slower onset compared to liquids or injectables. Liquid solutions, syrup, suspension, suitable for children or patients with difficulty swallowing. Risks may contain sugar, not suitable for diabetics, dose inaccuracies. Semi-solid, ointment, topical application for skin conditions. Risks, local irritation or allergic reactions. Gas, inhaler, used for respiratory conditions like asthma. Risks, overuse can cause side effects like tremors or increased heart rate. 4. Pharmacology and drugs listed. Fexofenadine hydrochloride, Fexo. Dosage, 60 milligrams. Common use, antihistamine for allergic conditions like hay fever, allergic rhinitis, and chronic urticaria, hives. Dosage guidelines, usually 60 milligrams twice daily or 180 milligrams once daily. Potential risks, side effects include dizziness, headache, and nausea. Fexofenadine is generally safe but should be used with caution in patients with kidney problems. Risk percentage, side effects are seen in around 2 to 3% of patients. Omeprazole, Ciclo 20. Dosage, 20 milligrams. Common use, proton pump inhibitor, PPI, used to treat conditions like GERD, gastroesophageal reflux disease, stomach ulcers, and acid reflux. Dosage guidelines, 20 milligrams once daily before a meal for 4 to 8 weeks, depending on the condition. Potential risks, long-term use can cause vitamin B12 deficiency, magnesium deficiency, and increased risk of bone fractures. May also cause diarrhea, nausea, or headache. Risk percentage. Long-term risks affect about 5 to 10% of chronic users, but side effects like headaches or digestive issues occur in around 1 to 5% of users. Rupatadine, Rupa, dosage, 10 milligrams. Common use, antihistamine used for the treatment of allergies, including allergic rhinitis and chronic urticaria. Dosage guidelines, 10 milligrams once daily. Potential risks, common side effects include drowsiness, headache, and dry mouth. Serious side effects are rare but can include heart palpitations. Risk percentage, drowsiness occurs in about 9 to 10% of patients. Other side effects are less common, 5%. Conclusion, each medication and method of administration has its own risks, benefits, and ideal use cases. Always ensure prescriptions are followed correctly and side effects are monitored, especially with long-term use of medications like PPIs, omeprazole.